sometimes people feel so hopeless, and just sitting down and talking with someone for, and obviously an expert, not just anybody, but talking down with someone who's equipped and skilled can give someone that hope again, and just that little flicker that they need to think, okay, more is possible, better is possible. If I just like stick with it, there's going to be some better options.
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area. Good morning, Dave.
Good morning, Andrew and Rachelle. We have a special guest here today. So I'm going to do a quick intro, and then we are going to get to know Rachelle through the podcast, because both Andrew and I have recently been introduced to Rachelle. We're familiar with some of the work that she's done, but this will be a neat kind of episode today because we're going to learn as we go. And I think we'll learn as much as some of the listeners will be learning, and we'll be just as curious as some of the listeners. So Rachelle Kay has spent her career at the intersection of government, community, and nonprofit work, always asking the same question: how do we build organizations that truly serve people? Rachelle is a nonprofit leader, governance expert, and passionate advocate for community mental health services based in Edmonton, Alberta, Canada, with a career spanning the private, public, and nonprofit sectors, including nearly a decade with the Alberta provincial government. Rachelle brings a wealth of well-rounded perspective to building organizations that truly serve people. She currently serves as the acting executive director of Momentum Counselling Society at Edmonton, nonprofit providing counseling, group therapy, and social work services. Rachelle's commitment to this work is also deeply personal. Living with anxiety, depression, ADHD, and CPTSD, she first accessed mental health services 20 years ago and has been an advocate for proactive mental health support ever since. Her perspective is shaped not just by professional experience, but by the kind of lived experience that doesn't fit neatly onto a resume. Navigating significant hardships across different areas of her life and choosing through all of it to keep showing up for herself and for others. For Rachelle, mental health advocacy isn't abstract, it's personal, it's practical, and it's why this work matters. Outside her professional life, Rachelle is a traveler, a Spanish speaker, a maker of pottery and messes, and a mom doing her best to keep up with a very precocious 9-year-old and overconfident mini doodle. So this is Rachelle. Actually, I'll just add a little bit that my introduction to Rachelle has been through Momentum Walk-in Counseling, where I've been doing the men's group for many years, and the executive director previously went on a leave. So Rachelle was the chair of the board of directors for Momentum for the past, I believe, 3 years, but recently has just kind of parachuted into a bit of a storm and landed in the executive director position. And so that's where we've met, but I was thinking about this in terms of a metaphor. It's like getting on the treadmill, turning the speed all the way up, and standing on the side, and then jumping on and trying to run as fast as you can. That's where she's at. So I'm even just surprised that she's making time or has time to join us here today. So welcome, Rachelle.
Thank you. It's very interesting hearing your bio read in a long nutshell. Yeah, it has been very much like that. It's like been jumping on board at full speed. Having been the chair, obviously I was already familiar with the organization, but from a much higher level. So yeah, getting into all of the day-to-day operations and the weeds has been quite the learning curve. Yeah, and I haven't had the time to do it at the pace that I might have preferred. So, yeah, accurate.
So, Rochelle, how did you land into this role? Like, just listening to how busy you are and Dave's analogy of getting on that treadmill on speed 10 without going up gradually from 2 to
Mhm.
4 to 5. Like, how did this all happen and just hit the ground running?
Well, yeah, it's kind of interesting. It has seemed very, what's the word, synergistic. Like just kind of all the pieces fell into place at the right times for the right thing to happen, I would say. Angela Ross is the executive director of Momentum Counselling, and we're good friends. She was a manager of mine back when I worked in the provincial government, and we've just kept in touch a lot over the years, and we have a very similar perspective on leadership and culture and those kinds of pieces. So we just each have a lot of confidence in each other, which is one of the reasons I joined the board for her organization. And she needed to go on a medical leave, and we were just talking as friends. And she's like, "How can I go on leave? Like who would step in? There's all these things that need to get done, and it's not a time where momentum is like stable and can just coast without an executive director."
Mm.
So I've been doing consulting work, and I just had a bit of a slower schedule over the summer, as often happens in consulting. And so I was like, well, I could not take on any new projects, jump into this full time. Yeah, one of the board members also like, how can you do this on top of your other job? I'm like, I'm not. I don't have another job. This is the only job that I'm doing. So it was just really, really timely that I had the expertise and skills to do the work and could also I'm probably going to be here 3 or 4 months. I started at the end of May, and it'll obviously just depend on Angela's medical circumstances and when her doctors say she's able to come back. So.
Okay. Yeah, again, this is news to me. So
Hmm.
maybe for the listeners, do you want to give a quick or in-depth, whatever you want, description of momentum, what momentum actually is, what momentum does?
Sure. Yeah. Momentum is a community mental health services organization that has been in Edmonton for over 12 years. So we're quite established in the community, and we really fit kind of a niche role. Like there are some other organizations that overlap with our services, but no one that really does what we do the way that we do it. So basically, our mission is to offer really low barrier mental health counseling and therapy supports. And we do that in a variety of different formats. So it can be one-on-one, we have group options. We also have expanded to providing social work services as well. And our group format has quite a few different, like over the years, there's been many different kind of, what's the word I'm thinking of? Like subject, I don't know, specializations or topics. That's a better word. The groups have very many different topics like ADHD supports or grief and loss, and then we have the men's group and a few that are longer running, but we just go through different ones as the needs are there. There's been a youth living life to the full group as well. And one of the more innovative things about Momentum is that we put a lot of interns through their practicums at Momentum. That's one of the ways we can offer really low barrier support. So when I say low barrier, what I mean is most people struggle to afford the cost of therapy. I'm getting nods from Andrew over here. Like the cost of therapy through a counselor is often $150 an hour or more, and then through a psychologist, $200 to $250 an hour, which is definitely what folks, should be charging, and it's worth that value, but it's often hard for folks to afford, especially those who are lower income. So we offer a sliding scale based on income, and it starts at $8 a session and goes up to
Mm.
$200 a session. So that's something a lot of folks don't know about Momentum. They're like, oh, we can get counseling for $8 a session. And if your income is low enough, then that is true. We don't offer any free therapy. Sometimes we get folks coming in thinking they can get therapy for free, and that's not the case. But $8 we consider fairly low barrier. And then we also don't require a referral. We can see anyone over the age of 14. And like I said, we have those different formats. So sometimes folks are more comfortable coming to a group session than they are to one-on-one. We specialize on solution-based single session therapy. So a lot of times, if we can see someone once and help them set up kind of a strength-based plan, they can take things from there if they have the resources and ability to do that. or they can see an intern for brief focused therapy, which would be like up to 6 sessions with the same person. And if they have different needs than that, we can also refer them to some of our referral therapists that have different specialties, and that can be more ongoing therapy, like 12 sessions or more with the same individual. So those are some of the formats that we offer.
So I'm always very interested about community mental health support because there's just so few areas of funding, when it comes to low cost services that help to break down barriers to services. I think it sounds the same thing in Alberta as it is here in Ontario. We get calls to our clinic and sometimes we're not able to provide sliding scales. And so people will ask, where can I go? And it's always, trying to do this deep dive,
Mhm.
into obscure services, if there are any. Or even when you do, it's like, wow, they have a significant wait list as well. They can't see the person for 6 months to a year because everybody's looking for services. So with Momentum, where does your funding or resources come from?
Yeah, I just want to back up on your question a minute
Sure.
because this is the first thing I should have said about low barrier. We can typically see somebody same day or within 2 days. That's our wait time, which is, yeah, like pretty incredible compared to everywhere else people are going. Even when you arrive someplace and you're in a crisis state, sometimes it's like a month to 3 months before you can get in to see a counselor, like through our healthcare system, like something covered by Alberta Healthcare. So that is really the role momentum serves is kind of in that in between time. Maybe somebody has an appointment booked 3 months out, but they need to see someone sooner. And maybe they could do like 6 sessions with an intern in between now and then, right?
Yeah.
So that's kind of, yeah, that waitlist piece is really, really impactful in the sector. Yeah.
So logistically, how do you even make that happen? We'll come back to the funding
Yeah.
piece, but as you
Yeah,
said
sure.
that, I'm really curious because like a day to 1 day to 2 days, like does that mean you always have someone on standby that they know that this is the expectation that you might be getting a call today or you might be getting a file today?
Yeah, so we usually have 5 to 6 interns doing their practicums with us at a time. And
Gotcha.
so they're trying to get as many supervised hours as they possibly can in the shortest amount of time possible. They don't have an extreme amount of flexibility. They have hours where they've said, "Okay, I can be here during these hours." We try to book them for those times. If we can book them in advance, that's great. But we do, I think every therapy clinic has this issue of people suddenly no-showing or canceling last minute. So usually it's those are early cancellations that allow us to fit people in really quickly. Like if it is
Mm.
same day, it'll be because we had a cancellation that day that we have someone available. But yeah, we have like online booking or people can call in to make an appointment or they can walk in to book an appointment and then we just get them in with the next available intern if we can. And then they do a 1 hour intake in advance of the session. So they can either do that over the phone or online and then be walked through with somebody to do the intake and then they can go to their first session. So yeah, sometimes we can do the
Oh.
intake and the session back to back. So like if they were being seen same day, they would do the intake and then go straight into session.
I'll jump in because
Yeah.
actually a bit of the history for myself was I I used to so I was doing my PhD at the U of A and Momentum was located on White Avenue further east, but it was close to where I was living, and there was a workshop. So I attended the workshop, and then from there I never left. Like it was like the atmosphere, the way that like the people who were originally starting Momentum out, I think it was called something like Walk-in Counseling Society of Edmonton initially. Like it was this like kind of
Yeah,
longer
Wisco, I
acronym.
think
Yeah, yeah.
was the original acronym.
Yeah.
Yeah.
But in the name was walk-in, right? And even for a while, Momentum still had that in their name was Momentum Walk-in Counseling because it was really a place where you could just kind of show up and get some sort of support, either like you're saying that day or the next day. And as a student or as a clinician working within from the inside, we were hanging out in the team room, right? And we
Mm.
were talking about therapy or different
Mhm.
aspects of the work we're doing. And then someone would show up, and then we would all be like, okay, who's going to see the person, right? Like
Mhm.
we were
Mhm.
eager to kind of work with the next person who needed support.
Yeah.
And I was like, oh, that is a really great way to meet people when they are, in a crisis, that there's like a
Mhm.
team of support that is ready
Mhm.
to help. And with the solution focused model, like even if one person is working with the individual, they'll go back to the team and say, here's
Mhm.
this person's, challenges and what resources do you guys know about? And then they go back to the individual and there's a
Mhm.
sheet that they leave with, at least back in the day when I was doing this.
That
Yeah.
still exists.
Okay.
Strengths and reflections document is what we call it. Yeah.
Yeah, yeah. So there was a sheet they'd leave with places or resources or even their own strengths that were noticed
Mhm.
in that session. And if they needed to come back, they could. But if not, we hope that whatever they got during that single session was enough to kind of move them in the right direction. So yeah.
It's really interesting the team dynamic around it. So interns that go through our program like praise Momentum as being like one of the best practicum opportunities out there, honestly. And it's because of the kind of support that they get. So all sessions are, whether it's virtual or in our office, they're all videoed and there's a supervisor who's watching and listening at the same time as the sessions are happening. And then we work in a 15-minute break where the intern will come out, consult with their supervisor, discuss what's been happening. And then, like you said, from whoever's in the team room, whether it's other interns and their supervisor, just kind of come up with some ideas for like what to go back in with. And then they have another 15 minutes to half an hour to adjust or suggest those changes or work with that. So they really get a lot of, both the client and the intern get a lot of support through even just one session. And then, of course, if they're seeing someone ongoing, they'll have time with their supervisor to discuss like the approach and what to mention and how to move forward with that. So it's really very supportive for the interns. They don't get thrown into the deep end. They, like understand what they're doing as they're doing it. And we kind of sometimes the supervisors will be in session with them if it's like early days in their practicum, and then they gain more independence as they get towards the end of their practicum with taking sessions on their own.
I'm really glad that you're speaking about this with the
Hmm.
interns and supervisors because, and I wanted to dispel this myth to our listeners because oftentimes, even at our clinic, you get people asking, "Oh, I don't want any trainees. I
Mhm.
don't want anyone who's in supervised practice." So in Ontario, if you're a new psychologist, you have to be under supervised practice from a licensed psychologist for at least a year
Yeah.
before they can practice on their own. And so
Mhm.
we get these requests, but I think often the misconception is that these individuals are not very good clinicians.
Yeah.
But I want to really dispel that myth because, and I've sort of asked my intake coordinator to tell this to potential clients is that you are getting not just the clinician, him or herself or themselves, but you're also getting the supervisor
Mhm.
who's going over the case almost
Mhm.
on a weekly basis, if not
Yeah.
more, to guide where the sessions are going. So, there's a lot of work being done behind the scenes, and that can be really beneficial, not just for the person in supervision, but obviously the client too.
Yeah, you're getting, maybe three or four or five heads
Yeah.
for the price of one, right? And we all know how when we have slightly different perspectives, you see different things. It's not all about years of experience, right? It's also about your personal experience, what you bring to each session. So yeah, I think that's nice to highlight that just because someone's an intern doesn't mean they don't have like a lot to bring to the table. So the interns that we have, they're masters of counseling students or doing their bachelor's of social work or doing their master's of social work. So they, they're interns, but they're not like fresh to this work. A lot of them have already been working as social workers for years before they do their master's of social work, right? So yeah, it's not necessarily someone who's like super, super green that's meeting with you. And like you said, even if they are, they're getting a lot of support from someone with a lot of experience.
Yeah.
Yeah, maybe I'll just one more example that's coming to mind is, and a big shout out to Jennifer Thompson, who's
Yes.
been around since the very beginning, was
She
away
was one
for a
of the
bit. Yeah,
founders of
yeah,
Wisco. Yeah.
yeah, one of the founders, and she's anyways, I could speak about her forever, but one of the things she's done is she's supported the men's group, and she'll be on site when we're doing the men's group in the evening. And for example, if someone is in crisis and group is actually not the best place for them, like they need more individual support, she will either see them or find another intern to be able to see this individual who actually showed up for group but needed more support. So that is just like one example of how, yeah, being able to be flexible and meet people where they're at and provide them with the services they need in that moment, because that is so important, right? We don't know what's going to happen when they leave and they didn't get any help, right? Or they showed up and they weren't able to be seen. We we don't have stats on that. It's hard to track that. And so that's what I've loved about Momentum all the way through, is that really does fill a huge gap in the public sector in terms of any kind of mental health support. So
Yeah. We do find there's a bit I'll just dispel some misconceptions about what Momentum does, is that we are no longer walk-in. So sometimes when people show up and say, "Oh, I was told I could come here and see a therapist," that might not be true, that we couldn't get to see them that day or immediately when they walk in. So it's usually only like, next day or a couple days, but sometimes that's disappointing to folks who are expecting to see a therapist immediately. And I think that's still just out there in the community around that walk-in, like, kind of our past service model. The other thing we're seeing a lot is, and this is because there's just less and less services out there for folks, but people coming in crisis or in a much higher needs place than is appropriate for our model. So we do have a pretty strong ability to refer out. So our reception team and our therapists will do their very best to say, okay, this isn't the right place for you right now, but where can you go? Rather than just, we hate to turn someone away and just not know where they ended up, right? We also incorporated a really amazing program this, was it a year ago? A bit over a year ago, called the Mental Health Co-Pilots. And that was created, it's a fascinating story, created by students at the U of A and one of their professors who identified the need for navigation services through the mental health sector. So saying people don't know where to go or how to find the services that they need, how could we help them? So they brought together, there's a team we currently have 36 volunteers. It used to be all volunteer based, and now we have one half-time paid position that coordinates all these 36 volunteers. So it's still mostly volunteer based. And they're responsible, or they've taken on the task of creating a really thorough database. So that's also on our website that anybody from the public can access, that is like a very up-to-date record of where any kind of mental health services, I think it's Alberta wide, not just Edmonton, can access. And then a lot of specifics about like, what the times are, what the specialty populations are. So that, and they also have navigators. So you can book a time with a mental health co-pilot and they will listen to your needs, do an intake, and then walk you through how to find the right service for you. So it's like a kind of an in-depth kind of referral handoff service that we provide. And it is very complementary to Momentum's other work, because there are times when we can't meet the need, and then we want to know that those people were served elsewhere in the way that they needed, instead of just sent, like, oh, try over here or try over there, and then they go somewhere else and also get turned away. And that's really hard when you're struggling. So
That's always so impressive, the ingenuity of students and
mhm.
yeah, their creativity and being able to take on projects to serve the community. And I'm still very curious, like having said that, the use of interns and students, going back to my initial question, probably like 15 minutes
Yes.
ago, where does this funding come from?
Yeah. So Momentum has historically relied on large grants from various levels of government. So we receive funding from our municipal government, from not from the federal government as much. I don't think provincial government has supported us quite a bit over the years, and then occasionally from some of the larger like foundations in the area, but it's been pretty much, I'm going to say almost exclusively grant based. So very few people understand the behind the scenes of nonprofit finances unless you have run a nonprofit before. Grant funding is really complex, mostly because you have to project into the future what you're going to need, probably a year or two in advance, then apply for something and say, hey, this is what we need, this is how we're going to spend it. And then most grants, and I'm not exactly sure why, but they want to pay for the service to the end user. So they want to be able to say, our funding served, 1,000 people that received therapy, and they want to pay for the action that serves the client. So like that's our service delivery end of things. Anyone who's run a business before knows that service delivery always needs to be supported by backend support. There's overhead, there's rent, there's insurance, there's, administrative support, all of those things. And those aren't like the attractive, sexy things for grant funders to pay for. So as we've expanded, we've continued to be successful getting grants for service delivery for the most part, but the size of the organization has increased quite rapidly. We've actually increased our service delivery by 6.5 times within the last 5 years. So that's a pretty significant growth rate for most organizations. And our admin support and like our back end systems we haven't found funding to increase those
Mm.
at the same rate or keep pace. So for example, we don't have a fund development team. We don't have people who are like, doing fundraising campaigns for us because we can't afford to pay people for those positions because it's not service delivery. So that's pretty challenging. And then the other piece is that funding from our provincial government has shifted in some pretty significant ways. And so Momentum actually lost $150,000 of funding that was funding we used to be able to rely on
Wow.
about 18 months ago. And that was, you can follow it through the kind of political channels in different ways. I worked in government before, so it's not too hard for me to see how all the threads kind of connect. So our government has shifted to seeing mental health as addiction services or addiction recovery
Oh.
services. So we don't provide addiction recovery services. We do assist people who have addictions. We do counseling for those folks, but we don't have like, beds or recovery services in our agency. So our services have kind of been, downgraded in terms of urgency or priority just based on that mandate that our government has around mental health. So there's still funding that goes from the Alberta government to mental health, but it goes mostly to recovery-oriented care and recovery-oriented agencies, which, has to do with addictions and addiction recovery.
Yeah.
Yeah.
But that's a sizable chunk to I'm assuming right now it
Mm.
hasn't we haven't found how to recover that 150,000 because I sit on a board in here in Toronto for the Brain Injury Society of Toronto, and I can't even imagine like losing $150,000 in grant money or sponsorship money. Like that would be a
Mhm.
huge, very, very challenging chunk of
Yeah.
money to lose. Yeah.
So our annual budget is around $1 million a year, what it costs to run the organization. So that's more than a couple of months worth of funding that we
Yeah.
lost. And yeah, it's very difficult to replace. So I think I'll describe the situation I landed in that David was referencing in a little bit, but basically, we doubled down on applying for more grants because typically we've been successful receiving grants. And this last year, in those last 18 months, we've applied for over $500,000 worth of funding
Wow.
and were unsuccessful in receiving any of that. So that's very different for us than typical. Usually, an organization like ourselves that's well established, has a great reputation, like has a long track record of providing service, we would be successful in at least 20 to 25% of the applications we put forward, right? So, looking back,
Yeah.
it's like regrettable that we didn't receive funding, but it was, would have been likely to happen, like, based on past experience, that should have
Yeah.
filled that gap and didn't. So what happened when I came into the role is, looking closely at the finances, realized, hey, we're so low on funding, we might not be able to pay, for the services that we've already had people deliver for next month or the month after that. Like our timeline is so short for keeping this organization operational. Like literally I was paying payroll and talking to the ED on leave and saying, "Hey, how are we going to pay payroll next month?" She's like, "I'm not sure."
Mm.
Right. So that's a pretty jarring realization to have. I think it was 2 weeks into covering. So, so I did, really pivot in terms of my priorities and what I was focusing on in that moment. We had a town hall with everyone in our organization to just be transparent about this is where our funding sits. So basically, we had some cash reserve, and over those 18 months, it was used up because we didn't decrease or cut services enough. There were some services that were cut or decreased during
Mm,
that time, but we would have had to decrease services pretty significantly to avoid having to pay that. And we were just relying on being able to have one or two grants come through that would have covered that difference, and that didn't happen. So right now we've just launched a fundraising campaign to advocate to the community and say, hey, if you want us to stay around, if you want this support to be provided, we need everyone else to lean in.
yeah.
And yeah, so we're really hoping to see that happen.
I was gonna ask about fundraising, or I may have
Mhm.
missed this, but like private donors, things like that.
Yeah, so we have had some really incredibly generous private donors step in just as we've been talking about the need. Because I mean, if you don't talk about the need, people don't know that it's there.
Exactly.
And like most nonprofits, every nonprofit always needs money. So it kind of starts falling on deaf ears where it's like, yes, we need more funding, we need more funding. And they're like, okay, yeah, that's always true, but also you also make it through. So this is different than that, in that if we don't receive funding, we will have to close our doors. So that's a very different message than our staff has heard before. That's a different message than the community has heard before. And so we're really hoping that encourages folks to pay attention. And, we're not over exaggerating either. Like it really is the reality of the situation. What I said about what we can have funding for is sort of the reason we don't have a strong fundraising base. You really do need someone who has the knowledge about fundraising, expertise, and time to put into it. Fundraising takes a lot of relationship building, a lot of follow up, a lot of like you said, especially with like corporate sponsors, you need to build those relationships over time. And we haven't been success like we have applied actually for funds to hire fundraising experts and never been successful, right? So it really has just fallen into the ED's role, which I can tell you also covers many, many other things. And so if I only put 5% of my time a week into fundraising, it's just not going to be enough ever. So that's kind of what has been happening. So Momentum's never had a very, I guess, structured and cohesive like fundraising campaign in the past. We have had, the odd donor who's come forward or relationships that have been built where people have contributed in a fundraising way, but we haven't had the resources to really proactively go after it. And now, basically, what we're doing now is just diverting resources from anything that's slightly less urgent. So roles that we do have a need for that do have work that they need to do, we're redirecting their energy towards fundraising for this period of time, but we won't be able to maintain that. We'll need to have them go back to doing their regularly scheduled work because that's what's needed as soon as this becomes less urgent.
Yeah. Oh, geez. I think my blood pressure just went up. So, to be completely honest, I've avoided a lot of this. Like, I love the work that I do, and I love, supporting momentum in that way. But I've been on other boards. I've, seen the backside of what happens and the struggle for creating like fundraising campaigns, but like committees or just pulling together human resources for people that maybe don't have that expertise, right? And that are like, well, big-hearted, well-meaning, really wanting to help. But like you said, someone with an expertise in fundraising, if you don't have that, can really be a detriment to an organization that is doing some really great work. So, yeah, I've fully disclosed that I have not got myself into this area for that reason, is because I
Mhm.
don't think it's my strong suit. So, I think we need funding now more urgently than ever. Like you said, I was one of the people that just assumed that
Mhm.
momentum would keep on going, right?
Yeah.
And as long as I don't know any different, I'm going to assume on the other end, they're doing what they can to get grants or funding, and it will continue because it's a great organization. And how could government or even corporate or private sector, how could they not support something like this, right? And now to hear you talk about how dire of a situation it's in,
Mhm.
and if I'm following you right, like essentially
Mhm.
you were running a deficit to keep the services going.
Yeah.
Yeah. Okay.
Mhm.
So
Yeah. For the
operationally,
past
yeah.
Yeah, for 18 months, we've been running a deficit of between five and $20,000 a month, depending on the month. And obviously, that's not sustainable. And nobody thought it was sustainable. We just really thought we'd be able to recover it through grant funding. And the lead time for grant funds is about 6 months at the shortest. So, like between getting an application in, having it approved, and actually have the funds come your way. And so we don't have 6 months anymore to wait for funds to come through. So we really have to shift where we're looking for those funds to come from. So the thing about like, Momentum offers a great service, how come people couldn't see that and why would it ever go away? It's a bit of a perfect storm, I would say, around that because, you know, it's a bit of a pass the buck thing happening, right? Where government is like, okay, yeah, that's important, but it's not as important as these other priorities that we have. And our government right now is trying to encourage private sector and corporations and other people with money to step in and provide things, especially if it's not something they're legally mandated to provide, which we wouldn't necessarily fall in that category. So they're kind of reducing what they pay for as much as possible and saying, hey, someone else has got to take care of this. If the community wants to have this, someone else has to step in. Corporations, I think, often looked at it and say, hey, that's something the government should pay for. This seems to be a really important service and people need it, so it should be a priority. So it really should be, paid for through our social programs. And so their expectation is they shouldn't be the ones putting out funding for it. And then individuals at the same time, it's like, okay, well, everybody's asking us for money from somewhere. Everybody's fundraising. I already pay, I already give money to these other organizations that I believe in. And also the financial uncertainty in the economy makes everybody hold all of their, if they have any extra dollars, they hold them close, right? So whether it's large businesses, there's so much uncertainty on the horizon that like we don't know when we're going to need those funds. So we don't think we can give them as donations or, to the nonprofit sector. And Momentum's not alone in feeling that squeeze. It is a really tough time. And those shifts in priorities, we're not the only one that's been impacted. I've talked to other EDs where they've also lost significant funding in a similar space, mostly programs that are more preventative or like upstream, not as much intervention or crisis are the ones that are losing funding. So I mean, we see it, those of us providing it, we know we keep people out of ER rooms and we keep people out of being in those higher cost crisis situations, but the funds still need to be there to run the ER room, right? So yeah, it's a really big time.
I think you explained a lot there. Like I had a bunch of follow-up questions, and
Mm.
your answer there, or your speech there, answered a lot of them. And one of my questions was, and this could be sort of speculation, but do you think that mental health funding or mental health nonprofits continue to be at a disadvantage in the sense that, it's mental health, like there's still stigma perhaps with mental health, or it's sort of this disability that you cannot see? Does that put mental health funding, especially for nonprofits, at a disadvantage?
Yeah, I think something I notice very much so is that mental health is not at the same level as physical health yet. We don't see the two as being equivalently important. I think there's still a lot of misunderstanding or lack of awareness around how we're holistic beings and our mental health impacts our physical health and our physical health impacts our mental health. And people are used to now having an understanding of like, oh yeah, I need to, go see a doctor. I need to, be proactive with maintaining my physical health. And there isn't the same understanding around being proactive to maintain your mental health. We also still hear this a lot where people use the term mental health to mean mental health crisis or mental health, you know, issue or like a problem, right? Instead of it just being like, we don't mean that when we say physical health, you just think like, oh yeah, your state of your physical health. You don't mean like, I have a disease, I have a crisis, right? So with mental health, we want to shift more towards that, it's a state of being. We all have a level of mental health. Sometimes we need assistance with our mental health. Sometimes we need to see a professional. Sometimes we are in crisis and then we need different kinds of supports. And I do still think it's like at a disadvantage, but like a secondary tier where it's like, okay, anything physical health is going to be prioritized first. It's obvious, we can see it. This person has a broken arm, they need a cast. That's going to happen for sure. Where it's behind the surface, and we still have some of those questions around like, is it maybe just that person's problem? Do they really need help and support? Is it something they could just manage on their own if they tried hard enough? Or like, this person is depressed and having trouble getting out of bed. Well, they should go on a walk every day or like eat better food or get more sunlight. Like you hear all of those things still, which for anyone who really understands those conditions kind of is, laughable in a sad way because that's really not going to be helpful for that individual. And that kind of advice is, pretty demoralizing in the face of what they're really experiencing.
Yeah, I mean this is just a bit of my own, but any kind of preventative, like even public health in the, physical
Mhm.
health arena, it just is hard to measure the impact, right? So someone goes for surgery or someone goes into the ER, there's some tangible kind of outcomes that you can measure. Whereas, and again, with mental health, it's hard to know. Even like, my own experience with the men's group, we see men come through the doors and it's hard to actually capture the impact that the group has had, right? We get to hear it and hopefully people return and they tell us like how things have improved and how or sometimes like a new participant is sitting in the room and some of the participants who've been there for a while explain why the group has been helpful or how it's been helpful, right? But to actually like put that into writing and have funders like see it and without hearing it firsthand, it's really hard. So I think there's just an issue with how do we actually communicate the impact or measure the impact? Yeah, so that's my own
That
problem that
has
I've been
been
wrestling with.
That has been my sticky problem for the past over a decade. Because when I was in provincial government, that was my area around prevention and early intervention for children and youth. And so it was constantly trying to figure out how do I prove the return on investment for
Yeah.
these community programs like Big Brothers Big Sisters, mentoring programs, which we kind of intuitively know, like if a youth has a mentor who is meaningful to them, it changes the trajectory of their life. But breaking that down into like dollars is difficult to say, okay, if you invest $5,000 a year into this youth having a mentor, it's going to lead to X results. We can't say, oh, for sure that child would have ended up in the legal system or incarcerated or whatever, because in the end that doesn't happen, right? We're like, oh, they end
Mhm.
up going to post-secondary and their life is different, but we can't say for a certainty it wouldn't have been that way if the mentor hadn't been there, right? So yeah, this question of proving that prevention is effective
Yeah.
is always such a challenge. There's lots that can be done to kind of show benchmarks and say like, okay, well, we know it's shifted in this positive direction, and we can kind of like make observations based off of that. But you really are relying on decision makers seeing it from the human perspective and not needing everything broken down into dollars and cents. And a lot of times those it just depends who's making the decisions where whether they can kind of connect the dots and go like, okay, this makes good sense. It's probably going to lead to good results, as opposed to needing to say like, okay, we're saving, $6 for every dollar that we spend. That's our ROI for this investment. Yeah.
Well,
Yeah.
and having a longer vision, right? I mean,
Hmm.
most politicians, most people in government
Four-year
that are
vision.
elected, yeah, it's a 4-year term, right? So
Mhm.
to see some of these returns actually takes a bit of time, and you might not see it within your term. And
Yeah.
so, what are you more likely going to put money towards, right?
Oh
If
my
you're going to
goodness. So
want to be
as a
reelected?
funder, I was asking people to measure like, okay, so your program for children and youth, show me how it's making a life-changing impact for your kids in 6 months, right? So like that doesn't happen. You don't like change the trajectory of somebody's life in 3 to 6 months and be able to measure it, right? You have an impact and like 5, 6, 10, 15 years later, that person looks back and goes, oh, if I hadn't had that happen to me, I wouldn't be where I am now, right? And it's so hard to capture those stories. So yeah, you're right. Having that kind of longer vision, putting those things in place that help the society in like a 20, 25 year frame isn't the perspective that governments are good at providing support for. Yeah.
As you were saying some of those things, Rochelle, I just kept thinking the number of adults who come to our clinic who are on disability leave, stress leave from work, like just the number of hours of productivity that's lost in the workplace. That's huge. Like if they want numbers, like it'd be so interesting even for me to just go back into our clinics files and add those numbers up and
Right.
and yeah, show people like this is how many hours lost. Like when someone is off 3 months, 6 months, a year,
Mhm.
that's a lot of productivity lost because of mental health.
Right. And that's part of our story to organizations is saying, we can provide services like outside of your EFAP to your employees, right? Either virtually or in person. If they're within Alberta, you can access that. And if we had partners that were like ongoing sponsors of Momentum, that's part of the story is like you'll have people showing up to work more regularly, less time off, less disability leave, and all of those things do affect your bottom line pretty significantly. And even it can affect turnover, right? So when you're retraining a new person because someone had to leave because the stress was too high, maybe that could have been prevented with, 6 single sessions. Like, wouldn't that be worth it for the employer to pay for them to attend those sessions and to get access to that service, right? So
Yeah.
yeah, from our perspective, there seems to be a really good case for it. Sometimes it's hard to get other folks to see it the same way or to prioritize it around all the other pressures they have, right?
It goes back to actually one of the TED Talks like years ago. This TED Talk might be like 10 years old. Kelly McGonigal, I think she was out of Stanford University. The problem with stress,
Oh,
right?
yeah.
Stress leads to so many other physical ailments.
Hmm.
And in her studies, her research just showed like if you look at all the physical ailments and then you take a look at stress, how
Hmm.
much of it originates from stress and anxiety, whether it's work from home or a combination of all areas of life, and how
Hmm.
much of that impacts our body and the systems within and causes ailments to occur.
For sure.
Yeah.
Yeah, I will say that me being in this role is actually a really interesting story of that because I would say the past ED, the buildup of stress of having these pressures, not being able to be transparent about it, holding all of that weight on their own shoulders, just really did build up over time. And she would say the same thing. I'm not disclosing anything she wouldn't say publicly, but, led to her body expressing that in all kinds of physical ways, right? So like pneumonia 3 times in the last year and different things like that, right? So it does, your body eventually will stop you if you are putting too much stress on it. And I've
Yeah.
been in that situation as well, where I'm like, I can keep going, I can keep doing this, it's going to be fine. I think I'm on count 3 of complete burnout now and hoping to never get to 4, wishing I learned something each time around. But that had been a big focus for me was, recovering from burnout maybe like 4 years ago. And so my cup was really full when I came into this in terms of capacity, in terms of ability to give of myself. And I'm still being very conscious about that in this role because this type of pressure could burn someone out again in 2 or 3 months. It's not impossible. So I'm just really prioritizing the things I do outside of focusing on finding funding and these pressures that bring me joy, that give, that distract my mind and make me think about something else and just kind of refill my cup in other ways. So that's hugely important as well, just looking after our own mental health as care providers or as leaders or any of those roles where there's a bit more pressure.
Well, I think that, I mean, like I said, when I first attended the workshop and got a sense of the environment, the culture, the feeling that you have when you're with an organization, I've noticed the shift, right? And I think you can't not feel the stress when there's
Mhm.
financial instability, right? And
Yeah.
I think funders or other organizations or individuals, like think about if you weren't sure if you could pay your mortgage or you could pay your rent the next month, and that is ongoing, that you're scraping by every month to make sure you can pay your bills. Like there's a stress and an energy that gets devoted to just surviving when
Yeah.
and then you're an organization who's there to support other people who are in
Mhm.
crisis, and how difficult that can be. So I think it's under misunderstood or undervalued in terms of just having stable funding for some of these organizations that
Mhm.
would be able to do more and better work because they
Mhm.
don't have to worry every month
Mhm.
or every year about their budget being cut.
Yeah. And the truth about nonprofit funding is that very few people fund for more than a year. 1 year of
Mm.
funding is like the standard. If you can get 2 years of funding, you're like praising, just like celebrating ridiculously. And sometimes there's a 3-year funding term, which is incredible, right? But usually it's year to year. So 1 year to the next, you don't know if you're going to get that funding again. There's quite a process to apply for it again. There's quite a process to report on those funds. And right now we have funding through 8 different funders. So that's 8 different reporting processes, 8 different reapplications every year. And then those shift, right? So we have to constantly be looking for new funders who will replace any that drop off this past year, like over the last year. So just maintaining the grants process, even if you're not focusing on fundraising and other ways of getting resources is quite a lot. And I think a lot of, businesses or folks that are structured in different ways than nonprofits don't really understand the strain that instability puts on things. Like most staff in nonprofit organizations are contract basis. They don't know from one year to the next if they're going to keep their job because we don't know from one year to the next if we have the funding for that position, right? And that can go on for 15, 20 years in an organization where you're on contract, like, year to year, because who knows if the funds are going to come through again. So it really changes the kind of planning you can do for the organization as well.
Yeah. So maybe let's get back to like how can people
Yeah.
support this or like momentum and I mean if you want this is maybe a stretch, but I do this sometimes. Like if you want to be a hero, like if you want to be a
Yes,
mental health hero, if you want to like we will be happy. I think Momentum would be happy to let people know who is giving donations, what organizations
for
might be
sure.
stepping up in this time of need. And so it can
Yeah,
be mutually beneficial, right? But
totally.
yeah.
Yeah, what we need the most right now is an organization that would step up as a matching partner. So we're really trying to encourage individuals to come on as monthly donors because that gives us a really it's our best chance at stability, really, having a large monthly donor base because you're not going to lose, $100,000 at once. You're going to lose $25 at once or $50 at once. That's a lot easier to replace. But people are much more motivated if they know their money is going to go further. So if we had, an organization who would say match monthly donations for the next 3 months, that would be incredible. That would really, really help our cause. We also would love to have ongoing partnerships with organizations where maybe we do like a monthly mental health workshop with their staff or something in exchange for some monthly funds. And of course, yeah, we're always happy to profile, on social media or however we can, like who our funders are and who our sponsors are. So that's easy to do. But a lot of times these days, organizations are looking for more than that, to be honest. So yeah, we can definitely have like therapists on site to do like a lunch and learn about mental health or kind of like that kind of public health education around mental health or like occupational wellness workshops with the staff or things like that we can exchange for funding. Individuals can go on Canada Helps and provide us a donation. They can do a one-time donation or a month or become a monthly donor. Like I said, monthly donors are our best chance at some kind of stability, and individual donations are our best option to get through this current like short period crisis. So I think those are the main ways that I see as being ways folks can step up for us. I mean, the other thing is just to get the word out, right? So we're sharing things on social media. So liking our posts, sharing our posts, letting more people know. Yeah, the more people that hear about it, I think the more we're going to have folks step up.
And just I'm going to say this quickly. For private donors, it is a nonprofit that you get a tax receipt, right? So
Yes. Yeah.
for those people
We
that
are a
are looking
registered
for an
charity. Yes. So
yes.
this is something some people don't understand. Not all nonprofits are charities. We are a charity. You do get a tax deductible receipt. Also, not all, therapy providers are nonprofits. So that's something we have to tell people too. We're not a for-profit agency. We are a nonprofit. That's a totally different structure. And we do give a tax deductible receipt for anything over $25.
Yeah, so I think that is super important to know because there is
Mhm.
I've heard just even during this time of
Mhm.
talking about needing to raise funds, sometimes people don't understand where the money is going and is the money
Mhm.
actually getting to where it's like impacting services.
Yeah.
And I know from, behind the scenes that a lot of the therapists or people working there are working for a reduced rate already. Some have deferred their invoicing. Others
Mhm.
have donated, become monthly donors, right?
Mhm.
So everyone is kind of pitching in and every dollar does matter. And it is not like you said, this is not for profit. This is not, filling someone's pockets. This is going right to keep the lights on and the doors open and the ability to keep providing a necessary service.
Yeah, I do think sometimes, I'll get the question from potential corporate donors like, well, what have you done about it so far? And so I can give a short recap. We've done, tried to look at everything that we possibly can. We've actually changed the structure of how we pay our therapists. We're paying less than we used to pay as of beginning of July. We're also, not accepting as many new therapists to come on board. We've adjusted some people's job descriptions, reduced hours in some cases. We have had several employees step forward and offer their time for free for a couple of months, which is incredible, but obviously not something we can expect them to do for the long term. So it's like a temporary measure that those adjustments have helped us know that we can get past August into September, which is great, but we really need to be able to raise those funds between August and September so that we can go back to paying those staff and continue to exist and not be running a deficit every month. So we are also cutting services and adjusting things. It's really important that we get to the place where our, income is more than our costs every month. We acknowledge that and recognize that, and I think are being very responsible in the decisions we're making around that. We also have an ethical responsibility to our clients to not just suddenly pull services away from them or not allow them to continue seeing therapists that they're in the course of seeing. And so we're really trying to balance that piece of like maintaining service provision in a financially responsible way, but also trying to keep the lights on at Momentum, even if it means Momentum shrinks in size to a certain extent. Like that's definitely on the table. We'd rather continue to exist and not grow as quickly or not be growing at all than keep pushing for growth and have to close our doors. So that's definitely the perspective we're taking on all decisions right now.
I know that we're coming up to our time, but to end the conversation on a more positive note, I'm actually wondering, Rachelle, I mean, I know you've been in this role just for the past few months, but I'm wondering if you can share sort of the most positive experiences that you've had so far as the executive director, whether it's through your observation or perhaps, relationships that you've built with people. What is it about your time at Momentum so far that's been really positive and memorable?
Yeah, so one of the first things I did when I came into the role, this has served me well in lots of other roles that I've began, was set up hour-long interviews with most of the staff to just like get to know them and talk about things. And I've just been really struck by how, I would say more so than any other organization I've been a part of, every staff member, every consultant we have, every contractor is so outcomes focused to what's the end goal for the client. So even with these, hard messages, insecurity, folks are not coming to me worried about, okay, what's happening with my paycheck? They're coming to me worried about what's happening for my interns or what's happening for my clients. How are we going to make sure that they still receive what they need? So that focus, that mission-driven focus is so strong throughout the organization. And obviously, the reason some people are saying like, I just won't get paid this month as long as my clients can be seen. Like that's pretty incredible. People shouldn't have to be in that circumstance or that position. And it also gives me a lot of hope. I've been saying for a little while now, I'm kind of irrationally optimistic. Like it's a high goal that we've set. It's a lot of funding we need to come through, but I really see that this team are the ones who could do it if anybody can, right? In terms of really talking about our needs and showing up the way we need to. And unfortunately, I think sometimes in the service sector, we're too self-sacrificing. We can take on that kind of martyr complex of like, okay, I don't need anything as long as everybody else gets what they need. So we have to balance that a bit. But definitely the heart for people is there throughout the organization. The belief in what we do, the pulling together for each other. I heard that over and over again in folks I interviewed, that they know the team has their back. The consulting work I was doing prior to this, a lot of it was around psychological safety in the workplace and helping organizations become more psychologically safe. So I did a lot of surveys to gauge that within organizations. And I did that when I came into Momentum. And Momentum actually had the highest scores I've ever seen in terms of staff feeling psychologically safe. It was like the highest rating of all the other conditions was I feel psychologically safe in the workplace, which that is pretty incredible because often it is one of the lowest in most organizations, even mental health serving organizations or even social services organization. You can't assume that that's the state and the culture of the organization, but here it truly is.
That's awesome. I love what you said there, irrationally optimistic.
Yep.
Sort of reminds me of that hopeless romantic
Yeah,
where,
I'm not one of those, but I'm actually
you hope for the best, even though it's a challenging walk,
yeah.
but hopefully, things get scraped together and then you sort of get propelled forward again.
Mhm. Yeah,
Yeah.
it's this balance between hoping the best happens, but not counting on it happening without effort. I
Yeah,
don't feel like we can
absolutely.
just kind of cross our fingers and say, okay, something will come through because something always does. I think we have to keep working hard and we need, people to step in. The same with people who are hearing this message. You can't just assume, okay, someone else will step in. This is a compelling story, so someone else is going to do it. It's that be the change you wish to see. If this is compelling to you, please step up yourself. Please get in touch, reach out with a donation, and I'll put our contact information and things like that where people can access it. But I'm happy to have a conversation with anyone who wants to know more, has more questions, would like to support in some way, or would like to become an ongoing partner. We'd love to see that.
If you're in Edmonton, come down and have a tour of
Yes.
Momentum and actually get to see where, this happens, where the work happens and really
Yeah.
like grassroots, boots on the ground kind of, yeah.
Yeah.
So, I mean, for me today, it's been really neat. I'm actually really inspired. In terms of just your leadership, you're
Thank
very
you.
genuine, very transparent. Uh, I don't think I've known as much about the financial situation, and I think for good reason. I think there are
Mm.
reasons why, people shouldn't know every single thing that's happening financially, but I think you communicate the sense of like leadership and stability in the midst of this chaos, and like I think the ship is on fire and it's taking on water, and you're still kind of just like, okay, if we just move on this side of the ship for a little while we're also doing this. But even from your bio right from the beginning, I just appreciate your genuineness, your transparency, and your passion for the work that you're doing. So it's been really neat hanging out with you for this hour.
Thank you. I sometimes say I listed, some of my diagnoses in the bio for reasons. I sometimes say those should be the letters behind my name instead of academic credentials. Because honestly, when people look at strengths and weaknesses, like I would credit my ADHD for allowing me to show up the way that I do in this particular situation. Because often folks with ADHD are great in a crisis, right? Like in crisis mode, I get very calm and focused and prioritize incredibly, stay focused and stay on track in a way that I don't if things aren't as urgent, right? So I think it's important when we look at different people's, mental health diagnoses or whatever, putting people in the right situations at the right time can really help them play to their strengths and help us see those things as not necessarily a deficit. I mean, ADHD comes with its challenges. I'm not saying it makes me a superhero or anything, but it does help me show up well in a crisis and help me stay grounded in those circumstances. It does have to be balanced with a lot of self-care on the other end to avoid the crash and burn. So just caution to anyone else who has ADHD and wants to step into crisis situations. Proceed with caution, but I think it's been beneficial that I could be here in this moment. I don't think I've said thank you for having me here. This has been a wonderful conversation, and I really, really appreciate you, giving the platform to talk about momentum, and I appreciated getting to know you both a little better, and it's been a wonderful conversation.
Yeah, no, thank you for enlightening us with momentum and what you do and some of the challenges and as well, some of the joys of being with momentum. It's everything requires that balance and there's going to be ups and downs and we'll find ways to keep momentum going. No,
Yeah,
no play on words there, but
keep the
um
momentum. We've said that a lot of times. Yeah.
right. And even right now, I've got some ideas of what we can do with this episode here, and we can take that offline. But we'll put Momentum's information on our podcast episode description, and really try to help with keeping things going. And in the meantime, again, thank you for being with us today. I know this was a little bit of a different episode, but nonetheless, as I was listening and having this conversation, I was like, it's nice to have a little bit of a different episode.
Yeah, thanks so much for having me here. And it's been great to talk through all of these things. And I think this is my, kind of first foray into podcast guest life. And I don't know if it's going to continue or not, but it was pretty fun.
Well, and I'm gonna do one more plug. I think, before you stop listening, hit pause, uh, and then just go to the website, Momentum website. We'll put some of this stuff on the description, but it's not hard to find Momentum on the internet, and it's not hard to click donate. You can use any credit card. So I personally donated $150 just in the last little bit, right? And so I've been through it and I've walked through, and it's very simple. It could take you like 30 seconds, right? And I know there's times where we say, oh, I'll do it later. And then, oh,
Mhm.
it's a month later, right?
Yeah.
So just do it right now if this is something you believe in and you want
Mhm.
to help out, and you can get a tax receipt for it. So
Yeah.
it's not the time of the year where everyone's scrambling to maybe see if they
No.
want to donate to a charity, but hopefully those that can will.
Mhm.
And yeah, this service does impact the whole community, whether someone directly or indirectly. So
Yeah, I'll just say all of us know people who need mental health supports or have at some point in time. If it's not us, we've had family members, we've had other folks. And it just makes such a difference for someone to be able to get access to support in a timely fashion. Like the urgency and the distress that you experience in a difficult mental health situation is so intense. Hearing that you need to wait 2 months or 3 months can be just devastating and honestly lead to a lot of negative consequences. Like we didn't go through some of the suicide statistics and stuff like that here, but those are very real and we could reference a lot of numbers around that. So sometimes people feel so hopeless, and just sitting down and talking with someone for, and obviously an expert, not just anybody, but talking down with someone who's equipped and skilled can give someone that hope again, and just that little flicker that they need to think, okay, more is possible, better is possible. If I just like stick with it, there's going to be some better options. So it's really important.
thank you so much, Rochelle.
Thank you.
If you like this, hit subscribe, you can find us on everywhere that streams podcasts. So spread the word, really share this episode with those that might be able to help out and those that are curious about nonprofit mental health organizations. Yeah. So spread the word, hit like, subscribe. We appreciate everything that you do to help grow this podcast, because the more it grows, the more people we know we're going to be affecting. So that is our mission, and we want you to take good care of yourself and take care of the people around you. Until another week, take care.
Take good care, everyone.